My name is Lauren McCarthy, and I'm making this video for my assignment for Adult Health 2 on the gastrointestinal system. For my disorder that I picked of the GI system is going to be a hiatal hernia. So hiatal hernia is a herniation of a portion of the stomach into the esophagus through an opening or hiatus into the diaphragm. So this common abnormality is usually found on x-ray, an examination that is done on the upper GI tract. This is most common in older adults and also in women. There are two types of hiatal hernias, the first being a hiatal hernia. So that is where the junction of the stomach and the esophagus, which is above the diaphragm, and the part of the stomach slides through a hiatal opening in the diaphragm. This usually happens when the patient is laying down in the supine position, but when the person does stand up, the hernia should dissipate and go back into the normal position. So essentially this occurs when the upper part of the stomach bulges through the large muscle, the diaphragm, which separates the abdomen and the chest. There is a small opening, which is the hiatus through which the food or the esophagus passes through before connecting to the stomach, and that's where this issue comes in. The second type is a paroesophageal or a rolling hernia. This is where the fundus and greater curvature of the stomach roll up through the diaphragm, forming a pocket alongside of the esophagus. The esophagastric junction, so where the two meet, will remain in normal position for this type of hernia. If a person does have an acute paroesophageal hernia, this would mean that they are having a medical emergency. The pathophysiology of a hiatal hernia can contribute. There's many factors that contribute to it. In even the development of it. So there are structural changes that do happen, as we all know, with aging. So one of the structural changes that happens in this part of the body is that there is weakening of the muscles in the diaphragm and around the esophageal opening. There are three predominant theories regarding the pathogenesis of a hiatal hernia. The first one is the increased intra-abdominal pressure, which forces the gastroesophageal junction into the thorax. So essentially it's pushing everything up. The second is an esophageal shortening, which displaces the gastroesophageal junction superiorly into the thorax as well. And then the third is that there's a widening of the diaphragmatic hiatus in response to a congenital or acquired molecular and or cellular changes in the creal muscles or the connective tissue. So there's no really straight definition of the actual cause of it. There can just, like I said, there could be various causes or conditions that can cause a hiatal hernia in a patient. So some of the manifestations, they can vary again from patient to patient. Some patients could be asymptomatic, but when the symptoms do become present, they are very similar to GERD. So there are factors that can also increase the intra-abdominal pressure that could make patients more predisposed to a hiatal hernia. Some of those would be obesity, pregnancy, tumors, if a person is involved or, does a high amount of physical exertion. And also if someone does a lot of heavy lifting, such as weightlifters, on a regular and continual basis. Other symptoms could be, heartburn, regurgitation of food and or liquids into the mouth, backflow of acid into the esophagus, so essentially acid reflux. If a person could have difficulty swallowing, chest or abdominal pain, shortness of breath, vomiting of blood or passing black stools, which would be a possibility of indicating that there is some gastrointestinal bleeding happening. As for interprofessional care, and a hiatal hernia is usually discovered when they are doing a test or procedure to determine if a person has, like, what the cause of heartburn or their chest pain is, and why it's happening, or their abdominal pain. This would include x-rays of the upper digestive system, an upper endoscopy, an esophageal manometry. And then some of the people that would be involved would be, a general practitioner, your primary care physician, a gastroenterologist, maybe a doctor who specializes in specific digestive diseases. And then if the symptoms become worse and are unable to be managed with medication, then a surgeon may need to be involved. So for the treatment of a hiatal hernia, it usually can be managed by medication, depending on what the signs and symptoms are. So if you are experiencing signs and symptoms such as like a recurrent heartburn or acid reflux, you may just need medication. And then, like I said, if it becomes too much, then you may have to have surgery. Some of the medications that are used are antacids that help to neutralize the stomach acid, such as like Mylanta, Broloids, Tums, which help to provide some quick relief. And there's also medications to reduce the acid production, which would be more of the H2 receptor blockers. So Tagamet, Pepsid, Axid, and then we also have the medications that block the acid production and also heal the esophagus. These would be considered the proton pump inhibitors. So they are stronger acid blocker. They're stronger acid blocker than the H2 receptor blockers. It allows time for the damage to be healed and repaired in the esophagus. As I've already mentioned, sometimes it is a person may be required to have surgery done. So this would be generally with people who are not helped by the meds and the heartburn is not relieved, and the acid reflux is not diminished. Or they have complications such as severe inflammation or narrowing of the esophagus. The surgery would involve pulling down the stomach towards the abdomen and making the opening of the diaphragm smaller, which would essentially be reconstructing an esophageal sphincter, or another option would be to remove the hernia sac. As for education, a big important part of the education for a hiatal hernia is lifestyle changes and medication. So it would be encouraged for patients to maintain a healthy lifestyle, healthy weight, or like an appropriate weight for their size. If they are a smoker, to try to either decrease or stop smoking. Stop would be obviously the better option. And also improving or readjusting their posture. So obviously if you sit up a lot straighter, it'll help all of your breathing mechanisms and everything that's going up or down just to stay in that column, rather than if you're like slunched over or pushed back. But then also minimizing bending or heavy lifting, because that is another reason that a hernia can occur. It's also helpful to stand after one eats. And if you do have these issues and have been diagnosed with a hiatal hernia, it is important or suggested when you go to sleep that the head and chest is elevated, so that again you get the proper flow and proper function of the upper GI tract. Another suggestion would be eat smaller meals rather than large meals. And if you were going to eat at nighttime, it'd be suggested to eat 2 to 3 hours before you are going to go to bed. Again, those small meals. So other diet modifications would include avoiding alcohol, avoiding caffeine, chocolate, peppermints, any fried foods, or like the greasy, like high fat foods. And then if someone were to have the surgery for a hiatal hernia, it would be suggested for a soft diet for the first week post-operatively. Again, with all the education, the plan of care would include just monitoring, modifications. A lot of it comes from self-reporting, because only the person, the patient, knows exactly how they're feeling or what they're feeling. So it's important for them to be honest with their doctor. If symptoms are getting worse, to report that, and also just to educate the people that they're close to, or the people that they live with, their caregivers, whoever it is, about when they might be going into crisis, or like when they should be contacting other people or contacting the primary care physician, or calling 911 if there is going to be an emergency. Yeah, so that is all I have on the hiatal hernia. Thank you. Bye.